I recognize that all of us are handed a deck of cards in this life, and while we're able to discard some of the less attractive ones, we don't always have control over the ones we draw. I don't need to tell you the obvious. There's much suffering in this world, and it's up to the strong among us to reach out to the less fortunate. Together, by raising everyone up, we all win. Everyone matters.
So you want to know what I like about working at the health center? I've been here for 20 years. I started when it was first open, and I've watched the center grow into something that I really feel that our community should never have been without and possibly can't be without now. We serve a great group of clients, clients that would have trouble accessing care anywhere else. I work with a great group of people. The center has grown from a staff of 10 to now a staff of over 100. And it's just such a great job, and it's so rewarding to work within your own community, and it's such a family environment here. I feel we do great work.
We have an excellent team of staff, volunteers, and board. We've learned lots of things. They have good hearts, they're persistent, they have individual commitments to work as a team, and a sense of respect and belief in the work we do. I'm most proud of the chances we've taken. We didn't stand in the middle of the road. We have an organization that does the best we can for the clients we serve.
I have seen this community health center grow by leaps and bounds over the years. It's been an amazing experience working with a variety of people on the board of directors. We have a very committed staff. They go above and beyond every day because everyone matters.
I love working at a community health center because you get the chance to collaborate with not only with people within the health center, but also those that you live with and spend time with out in the community. And as a result, you get to see kind of the effects of that.
So, welcome. I've been here for, as far as I know, 20 plus years. And I joined the CHC after I saw an advertisement. And it looked to me like a way of practicing medicine in the best sense for comprehensive care. And I believe in the model and the governance, and here I am 20 years later still doing the same thing.
So what I like about the community health center is fostering healthy people and making strong communities in the communities that we live. It's all about making great partnerships with all the different organizations in our area and supporting people at the grassroots levels.
50% of health is affected by the social determinants, and there's only one primary care model funded that addresses those social determinants day in and day out, and that's the community health centers.
I enjoy the people I meet, and the young people on the community health staff are excellent to work with, and they make me feel younger.
It's really a privilege to help people who have difficulty accessing healthcare, walk alongside them, help them get the care that they need. Also, the CHC model is very supportive of nurse practitioners and helps us work to a full scope of practice and encourages us and supports us in that role.
What I like about this CHC in particular is I got great people to work with. Most of the staff have been growing and growing and growing over the past 10 years that I've been here.
What I like about working at the health center is that it's a great staff team, and I get to work with a lot of people in the community, and it's a lot of fun. It's something different every day I come to work.
Why I love it here is that I love the team environment. I love that we have everybody cares for our patients and we can really give them good service, and the satisfaction you get from helping somebody who lots of times nobody else can or are willing to help.
I love my patients and I get enough time to take care of them, go through their medical concern plus their social concern. I have a good interdisciplinary team here to work with, good staff, and get the opportunity to do my care for older patients. So, love it.
I love working at a CHC because my background is in fitness and health promotion, and I used to work in the profit organizations where I had to charge people to help them do anything, and here I can literally help everyone and get them what they need and just be able to do it because they need it, not because they're paying me to do it.
The clients that we feel that we can affect in a positive manner as far as their core needs, food, shelter, programs, mental health concerns.
Yep. Meeting them kind of where they're at, all of the outreach, going to the mobile market, the Inn of the Good Shepherd.
It's one thing to see them individually, but I find it's a lot more productive to meet them at the inn or have them in a cooking class where they don't know how to cut an onion or cook a lasagna and meet them there so that now they are able to utilize the vegetables they've got at the mobile market for free and actually make something that's tasty.
And then enjoying it all together, eating it together, talking about how you would improve the recipe, creating friendships and relationships, building trust.
When you have a workshop that carries over week after week, then it's easy to be able to gain their trust in a setting and to be able to allow them to kind of break down their walls they've created and then gain the friendships, and that changes them.
I'm Bill Buckton. I'm a physician here at the Health Center. I started out in Forest at the North Lambton site, and now I've moved into West. Overall, it's been a great experience. I've worked in Kettle Point when I was out at the North site as well, and just the team approach, lots of support, being able to have a good relationship with everyone, and makes the work a lot easier. And certainly having all of the resources we have here for programs, diabetes, social work, the nurse practitioners, all of that makes for a nice continuity and good interaction with the team. So I really appreciate my 20 years, hopefully for another 20 years.
I love working at CHC because I have many great coworkers and I feel like we offer great services to all our patients.
I love working at the Community Health Center because we help people that have nowhere else to go.
My favorite part is working with the amazing staff here at CHC. They make everyone feel so comfortable, and we work well as a team.
The people. So the staff, the clients, families, and the collaborative approach here.
All of those programs that are intended to help the population stay well or to manage their problems in the best way possible. And that's the thing that I really admire and like about the Community Health Center, and it's one of the reasons that I came back to the board, is the fact that the model does ensure that people do get the best care and in the best way that we can provide. And it really is true that everyone matters in the Community Health Center model of care, and especially here at North Lambton.
Most of these programs, not all of them, but most of them depend very much upon volunteers. And I've always been impressed with the number of volunteers in each of our communities that help support the whole concept of the health centers. About 2 years ago, I became a rostered client myself, and now I'm seeing the health center from the other side as a patient. And I'm very impressed with the competence, the caring, the quality of the attention that one receives as a rostered client. The motto, everyone matters, certainly applies, because I feel like I matter.
I love that CHCs give their clients the time that they need during their clinical appointments. And I feel that us at North Lambton Community Health Center have really great nurse practitioners, nurses, physicians. I also love that our health promotion give a sense of like home to the somewhat lost souls of the communities. They give them a place to go and really deal with their social isolation problems and help them get involved in their community.
That it's very important there's supports in the community. We have a lot of programs. We do a lot with our elderly. We do a lot with our Aboriginal patients.
What is your last name? Underwood?
You're treated like a family when you come to us.
I love working for the CHC because of the staff totally believes in their job. They go above and beyond. And I like that I work with people like that who believe in their job and helping people.
I love working at CHC and being part of such an amazing team. Since I've been here, and all the wonderful things they do for the community, it's just really awesome to work here.
Well, I really love working here, actually. I love that we have, like everyone's on the multidisciplinary approach. I love that we have time to spend with each client instead of trying to cram someone in every 10 minutes, like a fee-for-service model. I love the clients we see, and we have a lot of people who come back regularly and use all the services here, and it's a great collaborative model.
So I've been working at the Community Health Center for 20 years now, and I can't believe it's been that long, but it's been my dream to be a staff of a community health center since my early days as a nurse. I believe so strongly in the model because of the interdisciplinary team, but more importantly because of the focus on the marginalized populations and people who don't get a fair shake in the rest of society. I know in this CHC we have a huge range of patients, but I think we shine in helping people who are on the fringes of society, and and our whole team wraps around them, whether it's our health promotion, our community navigators, our physicians, nurse practitioners. Everybody works together to come up with the best kind of support that's non-judgmental and try to build on a person's strengths, and all of those things permeate through the work we do at the CHC every day. And that work starts with our receptionists and filters right through to the whole team. So I don't think there's anywhere else you can work where everybody just works together, and it's such a great group of people. I'm always gushing about the CHC, and I'm just happy and proud to be part of it after all these years.